What is Swan Ganz? Swan Ganz catheterization, or also called right heart catheterization or pulmonary artery catheterization, is the passing of a thin tube or catheter into the right side of the heart and the arteries, leading to the lungs. It is done to monitor the heart's function and blood flow, and pressures in and around the heart. How the test is performed. The test can be done while you are in bed in ICU of a hospital. It can also be done in special procedure areas such as cardiac catheterization laboratory. Before the test starts, you may get sedative to help you to relax. Your doctor will make a puncture into a vein near the groin or in the arm or neck. A flexible tube or catheter is placed through the puncture. Sometimes it will be placed in the leg or arm. You will be awake during the procedure. A longer catheter is inserted. It is then carefully moved in the upper chamber of the right side of the heart. X-ray images may be used to help the healthcare provider to see where the catheter should be placed. Blood may be removed from the catheter. This blood is tested to measure the amount of oxygen in the blood. During the procedure, your heart's rhythm will be constantly watched using a heart monitor. A Swan Ganz catheterization is a diagnostic test used to determine whether any hemodynamic or blood flow related abnormalities exist in the heart and lungs. The procedure involves the insertion of a pulmonary artery catheter into the right side of the heart and into the arteries that lead to the lungs. The pulmonary artery catheter has a balloon tip on the end. The balloon allows the catheter to be carried by the flow of the blood to help the catheter move smoothly through the blood vessels and into the right chamber of the heart. The procedure itself is sometimes called right heart catheterization. This is because it can measure the pressure of the blood as it flows through the right side of the heart. It measures the pressure at three different places: the right atrium, pulmonary artery, and pulmonary capillaries. These measurements can be used to figure out the amount of oxygen in the blood of the right portion of the heart. It's also used to figure out how much blood flows out of the heart overall. The pulmonary catheter is generally inserted into one of three veins: the right internal jugular vein, left subclavian vein, and femoral veins. Right internal jugular vein is located in the neck and is the shortest, most direct path to the heart. The left subclavian vein is located under the clavicle or collarbone. It's a large vein on the left side of the upper chest area. The femoral veins are located in the groin. Pulmonary catheter is used to measure right atrial pressure, pulmonary artery pressure, pulmonary capillary wedge pressure, cardiac output, and oxygen saturations in the right heart chambers. The port and lumens. The red port is the balloon port. It is used to inflate the balloon in the distal pulmonary artery and comes with a locking guard and a pre-calibrated 1.5 ml syringe. Do not replace the syringe with a regular syringe. The yellow port is the distal port. It is positioned in the pulmonary artery and attached to a pressure line and measures pulmonary artery pressure and pulmonary capillary wedge pressure. The white port is positioned in the right atrium. It is used for administration of IV fluids or venous blood sampling. The blue port is the proximal injectable port located in the right atrium and is used for CVP monitoring. IV fluid may also be administered through this lumen and venous blood samples may be obtained. The thermistor is a temperature sensor that is positioned in the pulmonary artery and is used to measure the patient's core blood temperature. It is also used in calculating cardiac output. The thermal filament is used to calculate and display continuous cardiac output on the monitor. The thermal filament connector attaches to the optical module for displaying continuous mixed venous oxygen saturation, or SVO2. The Swan Ganz measures continuous cardiac output and cardiac index. Cardiac output is the amount of blood being pumped by the heart per minute, measured in liters per minute. Continuous cardiac output is obtained by the thermodilution method, which is pulmonary catheter that contains a thermal filament 10 cm in length, in addition to the thermistor located near the distal tip. The thermal filament is in proper position when it is located in the right ventricle. The filament emits 7.5 watts of thermal energy into the surrounding blood. The thermistor detects the changes in blood temperature, and the continuous cardiac output computer plots the thermal curves for calculation of cardiac output. The cardiac index is obtained by factoring the body surface area in order to normalize the value of the cardiac output. The normal cardiac index is 2.2 to 4 liters per minute. The Swan Ganz measures systemic vascular resistance, or SVR, and pulmonary vascular resistance, or PVR. The systemic vascular resistance measures the afterload or resistance of the left ventricle. Afterload is defined as the resistance the blood in the ventricle must overcome to force the valves open and eject contents into the circulation. Normal values are 800 to 1200 dynes. The pulmonary vascular resistance measures the afterload or resistance of the right ventricle. Normal pulmonary vascular resistance values are less than 250 dynes. The Swan Ganz measures continuous mixed venous oxygen saturation or SVO2. Measurement of mixed venous oxygen saturation provides information about global oxygen delivery, uptake, and cellular use. On average, the body uses about 25% of the oxygen delivered in the arterial blood during a resting time. Normal SVO2 ranges are 60 to 75%. SVO2 consists of the following factors: cardiac output, arterial oxygen saturation, oxygen consumption, and hemoglobin. The Swan Ganz measures central venous pressure, or CVP. Central venous pressure is the reflection of the pressure in the right side of the heart. The normal value is 2 to 6 mmHg. Central venous pressure monitor the fluid status of the patient. That's all for today's video. Thank you for watching. If you are new to my channel, press subscribe in my YouTube channel, follow me in Facebook, press the notification button to be notified with my upcoming videos. Thank you for your support.